Okay, so the last piece we're going to talk about is the neurologic system of a newborn. And first of all, we're going to talk about that transition point when the baby is first born. So there's a pattern to neurologic or to behavior in the first few hours after birth for babies that are full term and healthy. This pattern can be disrupted, obviously, if the baby has is either preterm or has some complications. But for a full term healthy baby, we usually see a first period of reactivity. It can be up to 30 minutes. This is right after birth. The heart rate is increased. The respiratory rate is rapid and irregular. The respiratory and cardiovascular systems are adjusting, so there's some instability there. The baby is usually alert. They have spontaneous startles and tremors. This can be a good time to initiate bonding and breastfeeding. And in fact, skin-to-skin contact tends to stabilize that heart rate and breathing. Meds that are sedating may actually dull this down. They may not be quite as reactive. After 30 minutes to an hour, or after 30 minutes or so, there's a period of decreased responsiveness. This can last for an hour or two. There's a decrease in motor activity. The baby may have shallow, rapid respirations, but good color. And they may appear to be sleeping during this time period. So they kind of zone out a little bit. And then there's a second period of reactivity that's 2 to 8 hours after birth, where they have intermittent tachycardia and tachypnea, increased muscle tone, increased mucus production, and the GI system starts to wake up. Now, what that means for parents who want to breastfeed, if they can get the baby to breast in that first period of reactivity, that can help get, first of all, get some colostrum and some bacteria, some normal flora into the gut just to start that process. But it can also begin to establish that breastfeeding relationship. If we take the baby out of the room during that time period and we're doing all the assessment and making sure the baby's stable and all those things, frequently by the time the baby's brought back to the patient, they're in that time period of decreased responsiveness. And so then it's very hard to get them breastfeeding until they get to the second period of reactivity. So if there has been a move for healthy full-term infants to stay with the mother, especially if they're planning to breastfeed. So that's those periods of reactivity. You need to know that the brain requires oxygen and glucose. So if there is a problem with oxygenation or there's a problem with blood glucose, they're going to have neurologic consequences. They're going to have neurologic symptoms of those. There are some newborn reflexes. You can look at these in your textbooks. There are different ways to test for each of these, but these are reflexes that are commonly seen in newborns. They should have rooting, sucking, and swallowing reflexes. Those are always stronger when the baby is hungry. They'll have palmar and plantar grasp, which means when you put something in the baby's hand, they reflexively will close over it. The plantar surface of the foot will also curl around. They have a tongue extrusion reflex. When you put something in their mouth, their tongue sticks out. That's protective. It's to keep things from getting in that they would choke on. There's the glabellar reflex, the tonic neck reflex. The Moro reflex is a startle. This is when the baby feels like they're being dropped. They'll jump, appear startled. The arms and legs go out and then slowly come back in. There's a step reflex, a crawling reflex, crossed extension, Babinski, truncal incurvation, magnet reflex, yawn, burp, stretch, hiccup, and sneeze. All of those are reflexes. DTRs are present, but they may be hard to elicit, and they may actually just cause a startle. And then there's a pull to sit reflex when you hold the baby's hands and try to pull them into a sitting position. They can't really support their heads. Their head lags behind, but you can see reflexively they try to right that head. So I want you to look at your books for how to elicit those different reflexes. I also want you to understand that I'm not going to ask 25 different questions on those reflexes. So you need to know them, but you don't need to spend all of your study time on those. Newborns have several sleep-wake states. They have deep sleep, they have light sleep, they have a drowsy state where their eyelids are fluttering, they're almost asleep. They have quiet alert when they are looking around, eyes are open but not making noise, and they're pretty still. They have active alert, and this is alert and moving around, crying. And you'll see them, you might see gradual transitions, but you may actually see pretty quick transitions between those states. Infants use behaviors to self-regulate when they're overstimulated. So if there's too much going on, they may withdraw, they may push away, they may break eye contact, they may just kind of shut down and look as if they've gone to sleep. They may get fussy. Sometimes they'll sneeze, things like that. Those are all things to self-regulate that stimulation. There are some factors that influence the fetus's or the infant's neurologic status and behavior. Gestational age, obviously, is one. How long it's been since birth, their feeding and sleep patterns, what stimuli are around them, what's going on around them, and medications can all influence that, as well as any kind of health conditions. Sensory development for newborns. At birth, the eye structure is incomplete and the muscles are immature. Their clearest vision is about 8 to 12 inches, which is about the distance when you're holding a baby to your face. So they tend to focus on the face. They prefer faces and black and white patterns. They will track lights and bright objects. Hearing is similar to an adult, but sometimes there's still some fluid in the ears that might take a minute or two. We do a hearing screen pretty early after delivery to make sure that they are registering sounds in the brain. The sense of smell is highly developed. A newborn can identify their own mother's scent within a few days. The sense of taste is developed. They tend to have a preference for sweet taste. They will always take more of something sweet. Infants are very responsive to touch. Touch and motion are essential to growth and development. But infants have different preference levels for touch. We also talk about infants' response to their environment, and we talk about different temperaments. Some babies are easy, some babies are slow to warm up. So I want you to think of that in terms of what kind of stimulation does that infant show comfort with, okay? So there are some babies who have very predictable body functions. They adapt to changing stimuli really well. They're more likely to have a positive mood and respond to new things positively. And their sensory threshold, the amount of sensory input they can handle, is moderate. There are babies that are slower to warm up. They may have a lower activity level. They're hesitant with new stimuli. They may be slower to adapt. And have less intense responses to new things. There are babies who have very unpredictable body functions. They have intense reactions. They respond negatively or very strongly to change or new stimuli. And these babies are more likely to cry for longer periods of time. And it's important for parents to understand this, because sometimes if they get one of those babies that's just more sensitive to stimuli, they wonder what they're doing wrong. And it may just be who that baby is. Habituation is the ability of a baby to become accustomed to and decrease their response to a repeated stimulus. So if we have the same stimulus happening over and over again, we habituate to it. we stop noticing it and stop responding to it. And babies do the same thing. Consolability is the ability of that baby to either self-console or to be consoled. So if the baby's crying and we pick up the baby, how easily do they settle down? Cuddliness, babies vary in how much they relax and conform to the body of the person holding them. Some babies are very cuddly. They just curl in and like melt into whoever's holding them. Some babies are stiffer, or they may not like being held, or they may want to be held specific ways. We also look at irritability. Babies vary in how easily irritated and how easily they get fussy. Crying is normal newborn behavior. Newborns cry when they are hungry, uncomfortable, in pain, want attention, overstimulated, when they're cold. It's important that we teach parents to respond to crying. The infant learns to trust their caregiver as a source of comfort when the caregiver responds to crying. Crying usually peaks around 2 months. It's very common for babies to have a fussy time of day when they're difficult to calm. That's more often in the evening hours. One thing to be aware with a cry is that a very high-pitched cry can indicate neurologic problems and probably needs to be assessed. Okay, so that is newborn transition information. The next lecture is going to be about the at-risk newborn.